is on the severe acute respiratory syndrome, or SARS. I'll be covering the background, contraction, diagnosis, signs and symptoms, prevention, cure and treatments, and experiment and future research of SARS versus my background. The name of my disease is the severe acute respiratory syndrome, or more commonly known as SARS. It is just an extreme version of pneumonia. The first known case of SARS was in 2003 in Hong Kong by a man named Zachary Pitcher. And within months of his first diagnosis, 8,000 cases were reported, and there were 774 deaths. SARS is an extremely contagious disease and can be potentially deadly. SARS can be found in these areas, such as China and USA. In red, that's where it is most affected, and in green, that's where it is least affected. Next is how you can contract this disease. SARS is believed to be caused by the coronavirus SARS-CoV. A coronavirus is one of a group of RNA diseases that can evolve into later viruses. SARS spreads like the common cold, which means through coughing and sneezing. If a healthy person touches or breathes in an infected droplet released by a cough or sneeze, they can become infected. Diagnosis. There are a few tests to confirm if a patient has SARS. These tests are blood cultures, viral respiratory pathogen testing, and pulse oximetry. This here is a picture of a pulse oximeter. Signs and symptoms of SARS. SARS follows a series of phases. In the first phase of SARS, patients may suffer fever, fatigue, headaches, chills, muscle pain, and malaise, which is a general feeling of discomfort. Next are a list of more but rarer diseases in the first phase, which are sputum production, nausea, vomiting, dizziness, and diarrhea. And then in the next and final stage, the patient may experience different symptoms such as dry cough, dyspnea, which is breathing difficulty, progressive hypoxemia, which is low concentration of oxygen in the blood, and respiratory failure. Next is how you can prevent SARS. To prevent SARS, you have to make sure you wash your hands with soap and water frequently, and to cover your mouth when coughing or sneezing, preferably with your elbow or with a tissue. And if you are exposed to SARS and develop symptoms of SARS, you have to limit activities that involve other people so that they won't get infected with SARS as well. And also notify a healthcare provider immediately. This here is a picture of how they prevent SARS in China, wearing the mask to cover their coughs and sneezes. Next is how you can cure and treat SARS. There are no known cures for SARS or vaccines, but there are many different treatments used to remedy SARS. In one treatment, a patient was isolated. Then a specialist would conduct a medical care team to treat symptoms of SARS. And then the World Health Organization and other local and state health agencies are notified of this case. Next is an experiment of SARS. This experiment was conducted to test if SARS came from the coronavirus SARS-CoV. Monkeys were experimentally infected with a coronavirus that was later known as SARS-CoV. The monkeys began to develop symptoms after a couple days, similar to the SARS patients, and the damage to the lungs were in a similar pattern to the ones that humans suffered. The evolution of this coronavirus in monkeys proved that SARS came from SARS-CoV in humans. Future research for SARS. It is possible for more cases of SARS to appear, but if healthcare agencies remain active and alert, large outbreaks of SARS can be prevented in the future. This is my introduction, and I will now answer any questions, comments, and
in the graph you had shown, there were green areas where you said it wasn't popular
The white area means that it wasn't infected at all. Miles.
Can you go back a few slides? Like, it was like a symptom? Yeah. You said sputum or something like that? What is it?
That's spit and
Oh,
yeah, mucus.
alright.
Yes.
How come SARS is only prevalent in US and China?
Well, in China, that's where it started. It traveled to USA by plane, and it reached Canada as well. But it hasn't, only a few cases were in those areas, so it wasn't able to spread very far. And in China, the economy is weaker and they can't afford treatment and stuff, like America can.
What does a pulse oximeter do?
I have not covered that in my research, but I'll get back to you on